So quarantine separates people from the rest of the population who may have been exposed to a contagious disease but are not quite yet sick. They have no symptoms of a disease process, and they need to be removed from the population to see and determine if they're going to develop symptoms of a disease and make sure that they don't then expose anybody else. If you are exposed to a disease process, specifically COVID-19, we know that the quarantine period is 14 days.
Okay.
And actually your exposure is day 0, and then 14 days completely. So isolation is different because now the individual is actually sick. The individual is showing signs and symptoms of the disease process and should not be around anyone, even for basic necessities of life. I think that the biggest concern is they're interchanging the terms and not really understanding the easiest way I remember is isolation, you're ill, you're sick. And then I'm able to remind myself, quarantine, I'm not quite sick yet. And so that interchanging of those terms, but they're drastically different. So quarantine, you can do things like basic necessities of life. You can seek medical care that's actually absolutely necessary. You can seek food, medicine, those kind of basic necessities of life. You also can, within our GEO order update, it does describe also an opportunity for people to go outside and have physical activity as long as you can maintain that you're not in a close proximity and going to be in a potential to be a direct contact of someone else. An isolated individual is ill, is sick, and should not be going anywhere. They are physically not leaving a location. All those basic necessities are being brought to them. And so it requires the support of somebody else to then make sure that they are able to get better, feel better, and not expose anybody else. How do you get out of quarantine? You will meet your 14-day requirement, and at that 14 days, if you have remained asymptomatic, have not required any fever-reducing medications, you never became symptomatic of anything, it's a discussion between that supervisor and that individual to say, I am no longer, I'm not having any symptoms of any type, my quarantine is up on this day, and then they can return to work. If you have tested for the disease process, COVID-19, day 1 is your test date, 14 days later, so by the 15th day, if you are, your symptoms have improved, you have remained fever-free without medications for at least 72 hours or 3 days, you can request through your PCM for either a virtual evaluation or an appropriate evaluation that they deem necessary, and get their clearance to then come back to work.
Okay.
Do need to make sure the public is aware of is once you test, you are in isolation. Regardless if you're feeling symptomatic or not at this point in time, you need to be on isolation for those full 14 days. And then the 15th day, you can request that PCM clearance. If you test and you are negative, and you are on a quarantine period, you still need to finish out that remainder of that quarantine period before you can request to come back to work. So day 0 is your exposure date for quarantine.
Okay.
And if you test, it's day 1, and then 14 days later, by day 15, you then can request to be cleared.
A PCM still has to clear a quarantine individual.
No, chain of command.
Chain of command.
Chain of command. As long as yes, okay. That's a good point. As long as that individual on quarantine has not developed any symptoms, they have completed their full 14 days, then they can come back to work.